Okay, this is how to read a pediatric growth chart. First, look at the top of the growth chart to make sure that you've chosen the correct one. This one is for boys from birth to 36 months of age. There will be a girls birth to 36 months of age, and separate ones for boys and girls over 36 months of age. So, number one, make sure that you choose the correct chart. All right, next, look at the age. And the age is from the top, across the top and across the bottom. If you scroll down, you can see it also goes across the bottom. Birth is this line right here. 3 months right here. 6 months. 9 months right here. 12 months, and so on. The first thing you want to look at is length, which is how we measure pediatric height. We call it length. And it can be done either in inches, so you'll see one measurement for inches, or in centimeters, so one measurement for centimeters. All right. So what you need to do is to find the age of your child, and then find their length that you should have recorded as part of your office visit. So let's take, for example, we have a 21-month-old boy. Okay, that would be this line right here where it says 21 months. Okay, let's say this boy is about 90 centimeters in length. Okay, so if you look down the centimeters line, here is 90. You can also see the same thing on the right-hand side. Okay, what you want to do is to find where those two lines meet. Okay, so come over from the 90 to where it meets the line for the 21, and that is right here at this little box, right over here. Okay. And we're pretty close to one of the lines that we see drawn on this chart. Okay, so now we've got where 21 and 90 centimeters meet. And if you follow this line up to the right-hand side, you're going to see a little number in the box. And that number, in this case, on the line that met between 90 and 21, is 95. And these are the percentiles, okay, for our patient. All right, so most of us would be found right at the middle at the 50th percentile. Okay, somebody smaller than average, or a child smaller than average, would be on one of the lower lines. And if you're larger than average, okay, you'd be on one of the upper lines. Okay, let's take another example. Let's say we have a 36-month-old boy, okay, who is about 37 inches in this case. So right here we see the line for 36 is all the way here towards the right. And if we come down, okay, this case we were in inches, so this is 37 inches. Okay, meets right about here. And in this case we sometimes just have to make a decision as to what line we are closest to. Okay, and in this case we're closest to the 25th percentile line, which is this line right here, where those two meet. And the number there is 25. So this patient would be in the 25th percentile, okay, for age and length. But if you scroll down towards the bottom of the chart, you can see that you can also do these measurements with weight. And weight can be measured in pounds or in kilograms. Right, so make sure that you're using the right slide rule, okay, when you're trying to meet up your two lines. Okay, so let's take an example of this. Okay, let's say we have a 12-month-old boy, which would be represented by this 12 here. And let's say that 12-month-old boy is 23 pounds. Okay, so here's our 12 months. We find where that meets up, okay, with our 23 pounds, which is approximately this line. And we just follow that line over, okay, until we find where those two lines intersect. And that is approximately right here on this dark line right in the center. And if we follow that line all the way up and to the right, we see that the percentile number that is associated with that particular line is 50. So this patient would be in the 50th percentile. All right, please do your homework assignment. Okay, I will give you a number of examples, and I would like you to see if you can calculate the percentile. We will go over the answers in class the next time that we meet. And if you're having difficulty with this assignment, please come and meet with me or send me an email, and I will certainly help to clarify any problems that you may have.